Good afternoon. My name is Jeff McKay from Brightsquid. Thank you for joining us today. We're going to go through top templates of 2022. With me, as usual, is Mark Ayer, who will take us through a demonstration. Hi, Mark.
Hi, good afternoon, everybody.
Thank you as well for being here. I appreciate it. So the agenda today, we're going to talk about a quick impact of templates on clinic operations. It's pretty obvious. It's about speed, being concise, and it's about making sure that messages you send have been proofread and you know what's in them. We'll talk about the top templates by sends. What are the actual #1 templates? We'll look at how medical clinics are using templates most, how dental clinics are using templates most. Next month, we'll be talking about bulk messaging. So we've identified a number of template types that are perfect for that, when you can send out one message to multiple recipients, so all your patients at once, if you need to notify them of something or send something out to everybody. In the demonstration, Mark will show you the pre-configured templates that are already in your account if you haven't made any yet, and how to create and edit and save a template so that anybody can use it, and as well how to send one, obviously. And then we'll get to questions. So the impact of templates, what clinics say is that templates save us about 2 to 3 minutes of typing with every send. This year, 240-ish clinics created new templates, adding to the total number of clinics that have created templates since they were launched in 2020. Templates sent this year about 225, 230,000, which is about 20% of all the messages sent in 2022 so far. Now, if you do the math on that, and we use 2 minutes here, that's a savings of 457,000 minutes, which adds up to about just over 1,000 workdays. And if you divide that into the number of clinics, every clinic using templates has saved, on average, about 4.5 days of typing, which is pretty great, because if you're like me, typing isn't the best. If we look at templates by individual sets, these are the ones that were sent the most. Pre-appointment screening, this one will change probably in the coming year. Clinics are still screening for COVID-19. This particular template was sent religiously in a clinic that serves quite a number of clinicians. So they're doing that screening through SecureMail, and all they did was paste their form into the template, save it like that, and people can type a response message right after the questions. Follow-up resources, nutrition information. So one clinic sending out nutrition information to a specific category of patients. Here's the stuff we talked about. This is what you should be doing. Here's some links. Here's an attachment that explains nutrition relevant to you and your condition, that sort of thing. So attachments can be pre-saved in templates, and Mark will show us that. Self-management tools. So this one specifically was a weight monitoring form. So here's a document you can use for self-management. There's a lot of self-management sort of resources that are sent out through templates. Intake form is a really big one. This is one specifically, but you'll find out that it's actually probably the most common use of templates. Pre-appointment reminder, or instructions actually, sorry, first. So here's some medication information, was that one specifically, but there's lots of other ways that instructions exist. Pre-appointment reminder, here's your appointment details, time, date, location. It's a phone visit, so make sure your phone is charged. A general one, so a signature. Somebody is sending out a secure message a lot, and they don't want to type their name and phone number and contact information, or a little blurb at the bottom that says, please don't forward this to anybody else, or if you're not the recipient, don't read it. That's actually quite common across most clinics. People are using those generally. This person obviously sends a lot of messages. Referral follow-up. Hi, we saw your patient. Here's what we found. Please see the attachment. Either an x-ray that was done or even just a consult letter. Next one, referral follow-up consult letter. These ones go out a lot. It's a great template to use, especially for dental clinics. Use it a lot. Just really saying, hey, here's what we found. Thanks very much. And then a referral request. Hey, here's a patient I'd love you to see. Here's their x-ray. Here's their patient information. Here's their insurance covered information. Please get in touch and provide some treatment. In terms of sort of generally looking at the templates, intake forms, templates are most common. They have the most sends per template. So on average, intake templates are sent 656 times per template. They're used quite heavily. They're also the ones that are most likely to include an attachment. Medical pre-appointment templates make up 22% of templates created and 50% of template sends. So pre-appointment information, getting patients prepped. Here's our policies. Here's how to get here. Here's some information the doctor would like to know beforehand, or some information the doctor would like you to know beforehand. Really helps clinics manage those appointments better so that patients show up prepared and on time. Medical clinics create on average about 6 templates each, so not a lot, but there's those standard communications that people are sending out on a regular basis. like the intake questionnaire, that sort of thing. Dental clinics typically create two, same with other healthcare clinics. Most follow-up templates include an attachment. So follow-up is, hey, we saw your patient. Those aren't necessarily pre-configured attachments, but like we saw in the one before, here's a nutrition sheet, here's a weight management sheet, or the treatment that we're going to go through, that kind of stuff. Those also typically include links to online resources, that sort of thing. So from a medical standpoint, I just want to talk about the template categories real quick. So we broke them into 9. Follow-up was one. Hey, we just saw you. Here's some information after that. In there is included things like, we saw you. Here's a lab rec that you talked about with your doctor. Pre-appointment stuff, appointment reminders, intake forms, instructions, policies at the clinic, that sort of thing. Hey, if you don't show up, we're going to charge you this much, that kind of thing. Invitation, adding new patients, that's starting to go away with the introduction of panel messaging, where you can message a lot of people at once. So you can actually onboard all your patients in one send. If you have all the email addresses, you can import them, upload that and send the message and do that invitation all at once, which is somewhat templated, but also saves you a lot of time going through that. Document send, general stuff. Sometimes those are notes. Like doctor's notes, sometimes it's x-rays, sometimes it's here's your records you requested, or other kind of things like that. General is signatures, that kind of stuff like I talked about, just templates that you're going to type a message into. Other information, so just nothing necessarily related to an appointment, just some updates. Instructions, not related to pre-appointment or follow-up, just sort of general stuff. Notice and then referrals. So medical clinics do have referral templates, but the use case for referrals and secure mail in medical hasn't really caught on yet. It is growing. There's a number of clinics that do it, quite a lot of it, but it's not as widespread. And notice is stuff like, we're moving our clinic, we have a new address, there's a new doctor working here, all that kind of stuff. So the top medical template categories, we've talked about a few of them. So pre-appointment new intake form. The form is pre-attached, typically includes instructions and or policies. We'll look at an example here in a minute. And consent forms are often included. So there can be more than one attachment. If you have the patient history form and you want them to sign off on a consent, either for just a general consent or just a secure mail consent, a lot of clinics are doing that. The pre-appointment questionnaire and screening, so COVID-19 is a big one. There are templates created specific to common complaints that clinics are dealing with as patients are coming in. We'd like you to answer some questions in advance about what you're coming in to talk to us about. Follow-up information, resources, self-management is a big one. Links to resources online related to a condition, tracking tools like the weight tracking tool or the nutrition tool, or information we talked about. Seasonal is another big one, and we'll talk about that as a bigger opportunity. Hey, it's flu season. Here's how to treat these symptoms for your kids or for you, or if you're elderly, that stuff gets included in there as well. And then pre-appointment instructions. Here's what to do to get ready for the procedure you're coming in for. Here's how to find us. Here's where to park. And then check-in and policies. Here's what to do when you get here. Here's who to talk to. Here's if we require a mask or not, if you're allowed to bring people with you, who to bring, where to go, how to sit, all that kind of stuff. And then follow-up forms, questionnaires, surveys, screening, surveys about, hey, how was your appointment? How's your treatment going? Screening for recall. You are a diabetic patient and we haven't seen you in 2 years. We really think you should. Or it's time for you to come in for your physical. Or the doctor would like you to have a mammogram because of your age and how long it's been since you had your last one. Condition monitoring stuff like that. Just, hey, please fill out this form to tell us how you're feeling with your blood sugar information, all that kind of stuff gets sent out quite regularly as well. So those are the kind of the top medical categories of how people are using templates, because they don't have to type them again. It's common communication. It helps that patient outreach be much more quick. So we don't have to deal with everything at the time of the appointment when they come in. Here's an example of the intake. You can see there's some categories of information that are typical. So preparation or expectation, here's what to expect. This has some instruction. This is going to be a telephone call, not a video call. Make sure you have your phone charged, be available, be somewhere with good reception. Instructions, right? So again, kind of expectation-y. So this is going to be about, don't ask the doctor to call you back. Be ready to go. We might call you early. We might call you late. There's a form attached. Please fill it out. Here's a little bit about how you can do that. One thing you might consider adding in here, and Mark deals with this stuff all the time, and I'm sure he'd love me pointing this out. If patients struggle with things like attaching a file back, our support team will work with patients. So you can always just say, "Hey, patient, go talk to Mark and his team," so that they can help you walk through anything, so that you or your staff don't have to. So dental template categories, dental clinics say they process referrals 75% faster using secure mail instead of mail. You can't fax an X-ray. So the big ones, referral follow-up is huge. Referral files, so just generally exchanging files. They could be a patient record, they could be a PAN or something that's going to both other clinics as well as patients. Pre-appointment stuff is also a big category in dental. So reminders, here's some information, intake forms, that kind of stuff. Follow up, either with a referral, hey, what's going on with that referral, or some of those are specialists writing back to a referring clinic saying, we tried to do a referral for your patient, but they never responded to us, or we did a consult with them, but they didn't proceed with treatment. And then billing. So, hey, patient, either we need more information for your insurance, or here's your invoice, here's your receipt, past due notice, that kind of thing shows up in there as well. So that's kind of the general flow of the communications that dental clinics are doing in a templated way. The top categories are pretty close. Referral follow-up is really big. We saw your patient, here's what we saw. And I'll show you a quick example of what that looks like. It's actually not a big message. And then the attachments are just added after the fact. Referral request, hey, like I said before, here's the patient information for the patient I'd like you to see. A file exchange, so here's some x-rays, here's the patient record. And then pre-appointment stuff. The examples here, so you see on the left, that's a referral response. So please see attached treatment plan letter and x-rays for a mutual patient. X-rays taken, type in date here. If you have any questions, please don't hesitate to contact us. As always, the continued confidence shown through your kind referrals is greatly appreciated. Sincerely, sender name. So there are things that you can put into templates that automatically populate both your name as the sender and the recipient's name. So we saw that above. The recipient name was put in on the intake questionnaire template. And then beside that, we have a referral request. So thanks in advance for reviewing this supporting information regarding a mutual patient. So then please find this stuff attached. So this stuff gets attached: insurance policy, claim authorization, x-rays, photos, and the patient record. If you have anything else, let us know. And then you can include your phone number, fax number, website address, people do, some details about other services you might do, so people have more awareness of what you're looking to do for patients. I said group messaging templates is a good category to look at. So these are the kinds of things that clinics are creating templates for to send out one-to-one with patients, but they can also work as a group message. Vaccination status was a big one. Clinics that created templates to say, based on what we've seen in your records, you are not vaccinated against this. Typically, it was a COVID-19 thing. You're at high risk because of your age, because of your weight, because of other pre-existing conditions, and here's why we think you should proceed with vaccination. A general sort of population health message, but also proactive patient management. We don't have to deal with these patients if they're at high risk, if they're not taking precautions. So it's an easy way for us to encourage them to do the things that we want them to do. Seasonal information and instructions, how to care for your child at home, for example, with a respiratory tract infection, risk-related resources. So, hey, here's some details about COVID-19, or you're pregnant and here's what you need to know about this and this and this, that kind of stuff. And then self-management resources for chronic conditions. Because you have this, here's some more information or new information, or you might find this tool helpful, that kind of thing, that can be sent out to a panel of patients specific to a condition. So that takes us through all the templates. Mark will take us through the pre-configured templates and how to send one, and then and how to create an edit template. So here we go.
Thanks, Jeff. So yeah, I'm sharing my screen right now, and what I wanted to show, I assume everyone here is already at least a little bit familiar with the Brightsquid secure mail interface, so I won't spend a lot of time on that. And as Jeff was saying, there are a number of templates already built into the application that you can take advantage of. Those are meant to be examples that you can build on to customize to your own specific messages. Jeff was saying, I mean, the obvious is using a template saves time. What's surprising, I think, to most people is how much time they actually can save you. You know, we talked about 2 or 3 minutes for every message in typing. I think it's actually a lot higher than that personally, but I'm not up for debate on that right now. But what I do want to say is it's going to save you time, and let me show you exactly how. So I'm going to compose a message to a patient. And I'm going to use the example of the new patient intake form. So this is for a new patient who's never been to my clinic before. You're all familiar with this. I've clicked on the compose button, and I'm now at the page where I compose my message to my patient. Now, rather than typing anything in the body of the message, the subject line, or even attaching any files, I can just deploy a template down here by selecting from this list that I have on hand, and I'm going to select the patient intake form. Boom, 2 seconds later, I've got the entire um, body of the message, the subject line, and my attachment are all here. It's still being uploaded, but that's fine. So now all I have to do, if I want to, is type in the name of the doctor this patient is going to be seeing. I'm going to say it's Jones, and the specifics around the time and date of their appointment. So January 12th at 3 p.m. at 1234 any street. That's it. Now, we could already populate this information into the template if we want to, but you can customize it to your specific needs, and I'll show you that in just a moment. Long story short, I can do all this in a couple of seconds without having to retype or copy and paste or drag and drop. Now, here's another really interesting thing about templates. When you send a message as a template, you can address it to multiple people and they won't know about one another. So it's like blind carbon copy or BCC as you're used to with traditional email. So for example, if I want to send this to my two patients, so Bob at brightsquid.com, and we'll invite Bob as a new user who's never been with us before. So I'll just go through this really quickly because you all know how to do this already. January 2nd, and let's say he was born in 74. And then I'm just going to add in, Susie at testemail.com. Oops, pardon my typo. You can see why I like to use templates so much because my typing skills are terrible. Susie, there we go. We'll add her. So now when I send this message, Bob and Susie won't know anything about one another. They won't know that someone else was CC'd on the message, but they'll both get a custom message, customized in that we'll insert their name here in the Dear field, and they'll be able to download their own version of this PDF document, fill it in, and send it back. So now not only am I saving myself time on all the typing, I'm I'm going to use the expression, I'm killing two birds with one stone, and then instantly regretting that expression. But nonetheless, that's that's what I'm able to do. So now when I click send, both Susie and Bob get a message, of course, from Brightsquid saying, hey, please fill in this form and send it back to us. And how that's going to turn around is if I look in my shared inbox, now I pre-created this one earlier, here's the message where Adam has filled in the information. So he's responded back. I sent him this message earlier today. He's filled in the form, confirmed he's going to be here on Friday. And now I can download this document and put it into his patient record so that the physician can review this information prior to his in-person or online appointment, as the case may be. Now, Jeff talked a lot about the different types of templates that we've seen our users create over the past year or two, and the mind boggles. There are so many things you can use the templates for. The intake form that I just showed you is probably the most universal example. Every healthcare clinic is onboarding new patients and filling them in and informing them about how their particular operation works. So you can customize these to the nth degree, whatever suits your particular needs. If I now show you how do you actually create these templates. If you've been using Secure Mail, you've no doubt seen this little select template dropdown. So you already are able to use the templates that are there. If you haven't already determined, you can make your own templates. Over here on the left-hand side is the templates link. Now, there was a recent update to our user interface, so this is a new location for this button, but it's always been there. And if I click on templates, we can now see all of the templates that I have. Now, in your live environment, you'll probably have close to a dozen that are already pre-deployed in your account that you can use or customize as you see fit. But what I'm going to do here is I'm going to make up a whole new template while you watch, just to show you how easy it is. So create new message template, and then I'm going to copy and paste some text that I have in another application, just like that. And I'm going to give the template a name. So I'm going to call this diabetic resources. Again, I apologize for the typo. So the title will not be seen by the patient, but the subject line will be. information related to A1, oops, 1C. Oh gosh, look what I've done. I don't need that open. Okay, so now I've given the template a subject line. I've filled in the body over here, and I'm going to attach a file that I want to create to inform my patient about whatever they may need to know. So I'm going to attach this PDF document. So now every time me or one of my colleagues on my team selects and deploys this template, this body with the blanks filled in, this subject line, and this PDF document will all automatically be inserted into the outgoing message. So let's save that.
Before you
Yeah,
move on from here, can you just hit the placeholder button?
yeah, certainly. I copied and pasted it because I was cheating. But if I wanted to include other or the way that we select these placeholders, you can just select them from here. So I'm going to delete this line and I'll do it the old-fashioned way. You know, dear, oops, placeholder, and it inserts the placeholder of the recipient's name there for me. And then at the bottom, of course, is the sender's name, which will be my name, appended with the clinic name as the case may be. So now when I save this and we go back to the compose page, inbox, compose, and we select that new template that I just made up called diabetic resources, and alakazam, I've automatically created this message that I can now send out to one or more patients. Now, quick sneak peek of next month's meeting. Jeff talked about group messages. Now, I showed you a moment ago when I sent that message to Bob and Susie that I could send the message to 2 people at once to save myself some time. We can actually do that to 500 people at once, and we can make it a lot faster for you. One of the features of Brightsquid Secure Mail that you may not be aware of is what we're calling panel messaging, also known as bulk messaging. And that allows you to upload a list of patients and a message just like this one that would go out to your patients through Secure Mail. And that can be hundreds of patients simultaneously. Now, as I mentioned, there was a recent change to our user interface. So how you find panel messaging is up here behind what we're calling the checkerboard. And this reveals all of the other applications that are available to you in your Brightsquid subscription. Now it's not loading because I'm in the middle of sending a message, so let me get that out of the way. I'm just going to delete that message. And then here we go. And so here under the checkerboard, you can see panel messaging, as well as all the training resources that you know and love, and other applications that your clinic may want to add on to their subscription. Not the focus of today's conversation, so I'm going to leave those for now. But here under panel messaging is where you can upload a list of patients, and you can use one of those templated messages that I just showed you, and you can merge that list and send out literally hundreds, if not thousands of messages simultaneously, and the time savings, I think, speak for themselves. Getting back to templates, one last thing that I wanted to make sure is well understood is any template that you create for your organization will be available to everyone within your same organization or clinic. And one of the side benefits of that may not be obvious, but I'm going to state it, or sorry, it may be obvious, but I'll state it anyway, is this engenders consistency across the organization. Rather than having Alice send a message one way with a certain wording and Dave sending it with a different wording, this way every single message that you send out in terms of, in this case, the intake form, is going to be exactly the same. You reduce typos, you create consistency, and it's a more professional outward face to your recipients. So that's about all that I had time for today. Jeff, I hear you on the mic there. Anything else you wanted to add?
Oh, no, we have some questions. So
okay,
excellent. There's a couple quick ones. We'll get through quickly. So the first question is a really good one, actually. Like, how many questions can we create? How many templates can we create?
There's really no limit to the number that you can create. The only real limit, I suppose, is the logistical amount of space on your screen in that drop-down list. And maybe 50, 60 would probably fit on there without a problem. So yes, and you can of course delete ones you no longer need. So not only can you create them from that templates window, yeah, you can remove.
I've actually seen a number of clinics that have just created new templates to update them instead of editing the old ones. It's probably easier, like you said, from that list perspective, just to edit them. As we saw, you go through that same process, you can just save a template again, and it'll save it with the changes. So that's really good. And then, there's a question: can we edit the pre-configured templates? So those ones that are already in your account, They'll have a little BSQ beside them, short for Brightsquid, because we made them. What can we do with those templates, Mark?
Yeah, you can edit them and then save them under a different name. So I didn't have a chance to show that button, but when you're working on a template, you can click the Save As button and give it a new name. So you could take, for example, the BSQ intake form template and resave it as Dr. John's intake form, and then you would have your own custom template based upon the version that we uploaded in the first place.
Yeah, great. And then who can create templates
So
within an
right
account?
now, anyone in the organization can create templates. We're considering restricting that to just administrators, but for right now, we've left it open to everyone with a Brightsquid account can make templates. If that turns out to be a problem for your clinic, let us know. And like I said, we were considering restricting that to just certain users, but for right now, it's available to everyone.
A couple quick points before we go. If you want to see more of these user groups, they're all stored on the clinic optimization tips tab under clinic performance at brightsquid.com. So you can check out the other ones if you want to learn about, the top features that were voted by clinic managers, learn about using SecureML to address staff satisfaction, clinic satisfaction, patient satisfaction. All those user group meetings are published and live on there. I will point out too, one thing to be careful about, Mark, you kind of pointed this out, is that going through the templates. So I actually went through the 1,000 or more templates that we have to categorize them like this. And I did see typos. I did see some that had some personal information written into them that were now saved as templates and they've been used multiple times. So just be careful when you're making them. Make sure you do proofread them, because that is, as you said, Mark, one of the key benefits of templates is to make sure that you know what is being sent out from your clinic, because we're just using a templated message that was typed and proofread and corrected before being sent out multiple times. That's our webinar for today. Mark, any other points, any other questions you get about templates?
I think the most common question we get is, can we make our own templates? Because Brightsquid did pre-deploy a bunch into your accounts for your use. But yes, once you've got your own templates and once you send a couple of templates, you'll be hooked, because it does save so much time. It's an efficient way to send and receive. And in my own personal professional life, I would bet you that half the messages I send are a template, because it saves me keystrokes, and that's what it's all about at the end of the day, I suppose.
Yeah, I was shocked at the total number just this year with the templates that have been sent. If you do the quick math on it, 1,000 days of typing were saved. Pretty impressive, given the reallocation of that time, right? Staff can do more productive things. If you go back to our webinar on staff satisfaction, you'll see that actually just retyping the same message over and over again produces more stress, increases dissatisfaction in work, makes people less productive overall. So templates really kind of help the overall function of your clinic, not just by helping people be faster at their job, but they actually make your job better. Make sure you try them out. If you have any questions, give us a shout. We're here as always to talk about it anytime. Thanks again for tuning in today. And Mark, thanks so much for your time as always.
Thanks, everybody. Have a happy holiday.